You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Lieutenant Governor of Michigan, Garlin Gilchrist, they have been dealing with a major issue there. Many people in Detroit have passed away from this. We have seen just this dramatic impact as well. He has created a task force to tackle the racial disparities as a result of social inequalities in places like Detroit and Flint. Lieutenant Governor Gilchrist, how are you?
Roland, it's good to be here with you, my friend.
First and foremost, let's talk about this. You just heard Dr. Taysom Bell. You hear this nonsense coming from Donald Trump that this thing might just go away. Well, vaccine, maybe we don't need a vaccine. We got therapeutics or whatever. Yet we're seeing people who are, a bus driver in Detroit, woman coughs, he's dead 2 weeks later. This is not, and all the people trying to talk about, HIV and AIDS, look, you can get HIV or AIDS and you can live for the next 20 years. We're seeing people who are dying 2 weeks later.
This is real. And to put this on a personal perspective, I've lost 20 people in my life to COVID-19, including a cousin yesterday. This is hitting our community, the Black community in particular, in ways that it's not hitting other parts of our population. In Michigan, Black folks make up 14% of the population, yet we've accounted for 40% of the people who've died, 41% actually, of the people who've died in the state of Michigan. So that disparity is clear, and this virus kills so quickly. And to your point, we have so many people of color, and Black folks are overrepresented in the people who, even in the midst of the stay-home orders that have been in place in Michigan and other parts of the country, have still had to go to work because you work at a grocery store, you're a bus driver, you're a nurse, you're an administrative professional at a healthcare facility, you're a utility worker, you're a first responder. And so you're out there risking your life to make sure others can stay home and stay safe. And that is one of the things that the Task Force on Racial Disparities here in the state of Michigan is looking to tackle. What kind of protections can we have for uniquely vulnerable people? And in places all around this country, that's Black people.
Are you in Michigan, are you getting what you need, or are you still battling with other states for PPE, for other things along those lines? Because you swear, listen to Kayleigh McEnany and Trump, that all states are getting everything that they need. We're all fine. We're great with tests. Everybody is good.
The lack of a national strategy on testing and on personal protective equipment absolutely directly contributed to loss of life in my city of Detroit, where I'm speaking with you from right now, in the state of Michigan and across the country. We have worked hard, and frankly, I think every state leaders across the country have worked as hard as they can to try to procure equipment, to procure testing kits and testing component in the absence of that national strategy. And we've put in place plans where now FEMA is stepping up, and now they are delivering equipment and testing swabs and components so that we can ramp up our testing, because there is no way to move forward without adequate testing. But we still need more from the federal government. This is the job of the federal government, to make sure that every state in our nation has the resources they need to respond to things that are bigger than statewide problems. And certainly a global pandemic qualifies for that. So we're on the right path thanks to the professionals who've been working so hard in Michigan, in the public and the private sector, at the municipal level and the state level. People have really stepped up and stood tall. So I'm proud of that work, but we have a lot more work to do, and we can do it better when we come together.
When we talk about how so many of us are being impacted, New York Times has a story now about all of these hospitals who have stopped surgeries, losing lots of money. Mayo Clinic could lose $900 million this year. Johns Hopkins, $300 million. But many of the hospitals that serve low-income folks are even in a more desperate situation. What is it looking like there in Michigan?
It's been a tough situation, and it's been, frankly, tragically ironic to see hospital systems doing cutbacks in the face of the biggest public health challenge of any of our lifetimes. But, it calls into question and under a bigger understanding as to how hospital business models work. Certainly the reason that we asked for there to be a pause in those sort of elective procedures is because we needed to make sure that all the equipment was available to treat the spike, or the potential spike, in COVID-19 patients, that we had as much medical equipment, hospital, bed, ICU capacity so that we could take care of people who may have contracted this deadly virus. And so as we move forward, as our public health system has built that surge capacity and now may have the ability to withstand any surges in the future, we're on a path towards re-engaging those type of activities and those kind of surgeries. And I think that's going to help that hospital business model.
Before you go, I got to ask you about this here. The decision not for the legislature not to meet because of these armed protesters. I'll be perfectly honest with you. I can't imagine state legislators, if a group of black protesters were there, they're saying, oh, no, we're too scared to meet. That's why you have police. That's why you have folks there. I mean, that to me, basically, these thugs got exactly what they wanted by intimidating state officials in Michigan.
Well, let me be clear about something. First of all, I'm the president of the Michigan State Senate, the first black person to serve as lieutenant governor in our state. And so I was presiding over the chamber when you had men with guns as tall as I am, and I'm 6 feet 8 inches tall. They're parading and intimidating and brandishing them and scaring lawmakers. And, we had a lawmaker from Detroit who wore a bulletproof vest because she feared for her safety. And you're absolutely right that if a group of armed black men came to the Michigan Capitol, where we still are one of only 2 states that allows open carry in our state capitol, yeah, that could have went a whole lot differently. And we were certainly thinking of the history with the Panthers when that happened and they changed the laws in the state of California and across the country. But I want to be clear. They were not there, frankly, about the stay home, stay safe order. They weren't there about COVID-19 because, you can't shoot a virus. So having a gun at that kind of protest or demonstration has another purpose. And especially when you couple that with the racist imagery you saw. I mean, we had a state senator wear a Confederate flag on his face. We had people having those Confederate flags draped on those weapons. We had Nazi swastikas. We had, sexist symbols of people hanging Barbie dolls because we have a female governor here in the state of Michigan, Gretchen Whitmer. That was a political rally empowered by the dangerous and destructive rhetoric of the president, who has politicized the response to this pandemic in a way that is costing people lives. And those people thought they were standing up for him. They were standing up for politics. But our role as state leaders and as public servants is to protect and promote public health and public safety. And so that means that we're going to make decisions for people and not for politics. And going forward, we're going to make sure that we have a more equitable distribution of how law enforcement treats people who are not stepping up and doing what they need to do to protect themselves, their households, or our communities.
So will the legislature in there in Michigan, will they step up and ban guns in the state capitol? Go ahead.
The ball is in the legislature's court. So our legislature in Michigan is controlled, both chambers, by Republicans. And I think one of the reasons why you haven't seen stronger action, and instead you've seen fraternizing with those people who were in our gallery with long guns, is because, frankly, they agree with the protesters. Because, as I said earlier, they have politicized the response to a pandemic. We are planning in the best interest of public health and people, following the world-renowned experts, including the leadership of our medical executive, Dr. Jonae Caldoun, a black woman. They may not like the fact that we have such a diverse leadership team here in the state of Michigan. But I'm here to tell you that we're working on behalf of the people of Michigan, and we challenge the legislature to step up and do the right thing to make sure that lawmakers can do their job and conduct the people's business. The legislature claims they want the power and the opportunity to do that. It's difficult to do that under the intimidation of open carry brandished firearms.
Lieutenant Governor of Michigan, Garlin Gilchrist, we certainly appreciate it. Thanks a lot.
Thank you, Roland. Take care. Stay safe.
Yes, sir. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardy, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patal Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Intimidate Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division Strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and Wellness Specialist Dr. Yolanda Hancock. Desmond Meade, President of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriot with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julian Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.